All right, guys, we're going to break down Jonathan Kuminga's recent ankle injury, talk about the different diagnoses and his potential recovery and prognosis. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. All right, guys, let's break down this injury. So Kuminga's playing on defense. He's contesting a layup, jumps up, and one of the most common and unfortunate things that happen in basketball, he landed in someone's foot. His foot goes out to the side. Those are the classic signs of a lateral ankle sprain. But we're going to break down what exactly gets sprained in an ankle sprain and the recovery looking like. So what is an ankle sprain? So when we talk about an ankle sprain, a lateral ankle sprain, there's three main ligaments that mostly get injured. So the three ones are the ATFL, CFL, and PTFL. Because it went out to the side and he was in this motion, we're thinking more the ATFL and CFL, which are the most common ones sprained. So when it comes to a sprained ankle, you're actually tearing part of the ligament. And depending on how severe it is, it depends the level of the grade of the ankle sprain. So for Kuminga's specific injury, they said he's going to be reevaluated in 3 weeks. So whenever we're thinking that 3-week timeline, we're thinking it's not a simple grade 1, it's mostly like a grade 2. And he could have potentially injured some other muscles around the ligament itself, the peroneal muscles that go onto the outside, that get stretched out when your foot goes out to the side, because those tendons go to the outside portion of your foot. So whenever you rotate out to the side, they might have gotten strained there. Based on that, how they said, it's more looking like that 3-week, potentially even more. So for Kuminga, when it comes to his prognosis and recovery, so when it comes to his rehab, I know we've seen some videos of him walking in a boot. So that's very common after an ankle sprain because you want to first kind of offload the foot. It's initially for the first 3 days or so, maybe use an ankle brace as well. And from there, you're really going to work on your range of motion, work on your stability, because the big thing about these ankle sprains, if you don't fully rehab them, you're going to re-sprain them again. And this is where we have our plug for our ankle sprain rehab program. If you guys are dealing with an ankle sprain, make sure you're really doing your rehab. We have a great online ankle sprain rehab program that you can do all at home. Click the link below. And the big thing with these is you really want to make sure you pass your test before you go back. You know, a simple ankle sprain could lead to injuries up at the knee, hip, and re-spraining the ankle and lead to chronic ankle instability. So for Kuminga, he's really going to make sure he's able to have the full range of motion in his ankle, able to do as many calf raises as he can from one side to the other, and then doing hopping tests that he feels comfortable on that ankle. And we have more videos on that if you guys want to check out our library on ankle sprain rehab. But big thing with this, you want to ensure the safety of him slowly getting back to basketball, because we don't want him to jump right in there with his ankle not feeling 100%, and that's going to cause re-spraining of the ankle. If you guys have any questions regarding ankle sprains, or if you guys want to learn more about any other NBA injury, just comment below. We'll try our best to shoot the video. And we are the Basketball Doctors. Let's ball for life.